Okay, we'll go ahead and get started. Thank you all for being here for our COVID-19/RSV media availability. We will just have District Health Officer Kevin Dick on the call today, and we'll have questions available at the end. Kevin, if you're ready to go, please take it away.
Yeah, thank you, Scott. Got sort of a small group today, so maybe it'd be the Wolfpack basketball game gets all the coverage tonight. But I want to thank you for being here, and I've got pretty good news for us today. As far as our COVID-19 update goes, our CDC community level remains at low, and our 7-day average for new cases is at 24.86, so about 25 new cases per day. That's down from about 26 new cases per day that we had last week. And our total cases for this week is at 170, and last week it was at 180. So fairly flat, but some decreases that are occurring. And on the variant front, we had our staff look at the COVID-19 variants that were reported by the Nevada State Public Health Lab from December 28th to January 24th, so a 4-week period there. And we had 69 positive COVID-19 samples that the lab had sequenced. The BQ1 and the BQ1.1 continue to be our predominant variants. And they make up about just over 50% of the variants that we have that are in our community. The XBB variants continue to receive attention nationally. In Washoe County, looking at the XBB1 and 1.5 and the XBB2, those variants made up just over 20% of our sample sequence. So we are seeing an increase in the percentage of that variant, but not at the levels that we're seeing nationally. On wastewater data, the latest wastewater data from UNR shows slightly decreasing trends in COVID-19 concentrations detected. And so overall, that data is very positive, and we're seeing historically low detection levels. Our hospitalizations, the Nevada Hospital Association reported that flu, RSV, and COVID-19 hospitalizations are decreasing or remain flat statewide. So good news there as well. You probably saw that President Biden intends to end the COVID-19 public emergency on May 11th. This announcement has not impacted the health district's operations. Our COVID-19 contact tracing and disease investigation duties will remain active for those are focused on outbreaks in congregate settings at this point and catching up on information on cases when we were overwhelmed in previous surges. And our testing and vaccine operations also will remain active. We plan to continue to offer free testing at the Livestock Event Center twice a week. And we plan to still offer free COVID-19 vaccines at our clinic at 9th Street, at community events, and through our homebound program. So for any information that people are seeking on vaccines or testing, please call us at 775-328-2427, or you may also go to covid19washoe.com. On the RSV front, I'm happy to report our RSV cases reported in Washoe County remain low. We had 34 cases reported last week, so that's flat. We reported 34 cases the week prior to that. This is down significantly from the peak that we saw of 263 cases in a week. So the 34 cases that we report for the last week ends a streak of 7 straight weeks of declining cases that we've had from that point. So we're in a much better place now than we were at the end of November and early December. And on influenza, our influenza-like activity remains low. We have 0.9% of cases that are seen by our sentinel providers that are influenza-like symptoms that they're reporting. From the testing, we're seeing predominantly type A flu that we've had occurring in the area. Like RSV, we had a surge early in the season for flu cases, but we've seen a significant decline, and Nevada is considered to have minimal influenza-like illness activity at this point. So back to the end of the emergency declaration, people may wonder what to make of the announcement that that is going to be ending on May 11th. I think a couple of things that people can derive from this is, one, we are no longer in an emergency situation. Our hospitalizations are much lower than they were. As you'll recall, in previous portions of the COVID-19 pandemic, we were very concerned about hospital capacity, and we were working to flatten the curve of new cases. And we're not seeing those kinds of impacts occurring on our healthcare system. We still have COVID-19 circulating, but for the most part, people are not becoming severely ill or needing to be hospitalized. But risk factors vary based on age and health conditions, and people need to account for that in their decision making. So moving forward, I think people need to make decisions with an understanding that our older population is more at risk of severe flu cases severe COVID-19 cases and potential for death from COVID-19, as are people with other underlying health conditions. And people should factor that into their decision making. I think we've all learned a lot about how to prevent the spread of respiratory disease as we've gone through the COVID pandemic. People should remember those lessons and continue to follow those practices of washing hands frequently. It does no harm to wash your hands, and it's a good preventive measure. People should stay home if they're ill and avoid spreading disease to others. And if people are in high risk levels for COVID-19, they may want to make decisions such as mask wearing if they're in crowded places indoors, or limiting their exposure to those crowded indoor environments. But those are decisions that people should make based on their personal risks. And then people should also remain up to date on all of their vaccinations, including their COVID-19 vaccination. So that concludes my briefing for today, Scott. I'd be happy to take any questions if you want to ask or run that part of our show. Thanks.
Okay. Thank you very much, Kevin. Any questions? Okay, we'll just assume you got all the information you need. So we are recording this. We'll put this on the COVID-19 washoe.com website, and I can send it directly as a raw file or a YouTube link. If you guys want to use any of this footage, you're free to. So with that, thank you, Kevin, for your time. And then if any media have any questions, feel free to reach out to me. Have a great day.